Good morning, class. For our asynchronous today, here is my presentation. Okay, I'm going to screen share now. So we will be discussing the assessment of the head and the neck as an overview of the anatomy and physiology. Actually, I think you've already tackled this one. The skull is the framework of the head, and the structure of the neck is composed of muscles, ligaments, and the cervical vertebra. Now, the sternocleidomastoid and the trapezius muscles allows the movement and provides support in our head and our neck. The thyroid gland is the largest endocrine gland in the body, and several lymph nodes are located in the head and the neck. So this review of our skeletal-muscular system. Now, this is your sphenoid bone, temporal bone, the temporal fossa, the acoustic meatus, external, and then the mastoid process. Now, this one is your zygomatic arc. This one, the arc, and then our mandibular notch at the bottom. Now, the ramus of the mandible is this depressed area, and the mandible is this lower portion. Okay, and then the hyoid bone is the one that is right under the mandible, protecting the next the epiglottis further, because this is more of a cartilage, this thyroid cartilage, and the epiglottis are soft bones. Now, the trachea connects the thyroid cartilage, and below your trachea is your first rib. Okay, the stylomandibular ligament is found near the mastoid process, and then the stylohyoid ligament connects the mandibles and your hyoid bone. Okay, and basically this one is the angle of your mandibles. Okay, in terms of muscle, we have our splenius muscle, our thyroid muscle, hyoid muscle. I'm sorry for that one. Levator scapula, our sternocleidomastoid muscle, is located in this area of your neck. And then your scalene muscles. Okay, we have the anterior, the middle, and the posterior, and the trapezius muscles also. And then the deltoid muscle, this one. And then going back to the front. Okay, so we have the hyoid muscle. Okay, and then the sternohyoid muscle. Okay, below. Yan siya. Paharap ng paharap. Yan. So ito sa likod, yan, papunta sa harap. Now, we also have our larynx. And then our cartilages, mafe-feel nyo naman yan dito. And of course, our thyroid gland. Okay, and this one is your windpipe or your trachea. So, in the assessment of the head and neck, what equipments do we need? So, we may be needing what? A clean gloves for infection control, a small cup of water for clients during a thyroid exam. This is very important kasi baka mamaya, this clients of ours or patients of ours might require water during an examination, not feeling comfortable themselves, or maybe they're not feeling well themselves. Okay, next, you might be using a pen light. Okay, not your cell phones, please. Then padded tongue depressor, and then a gauze, a nasal speculum. So this will be the things that you would be doing when you make your head and neck inspection. In obtaining subjective data, you have to make focus questions. Now, this focus question includes the onset location, the size, and the texture of your lumps. Check if there are limited movement. from the neck. It should be free, but you know, not the one. Your neck doesn't turn 360 degrees. That's a different thing. You might want to call a priest if that's the case. So, facial pain, neck pain, and headache, you have to have the client describe it. Okay, are there prior neck injuries? Are there history of head or neck cancer? And in obtaining the subjective data, you might want to consider asking also risk factors such as high risk sports, lack of protective devices, violence at home or elsewhere, and even falls. Any history or risk factor of head injury. For thyroid diseases, of course, you have to have a family history and exposure to high levels of radiation. It depends on the occupation. You might want to question that one. Now, for lymphatic enlargement, immunosuppression, and chronic disease. Okay, these are subjective focus questions that you need the client to answer for you. Also, in terms of head inspection, you have to what? Check the size of the head, and if what we're looking is a normal size, it varies from one person to the other. But what is not normal is that it is very small and very large for a person. Symmetry, in terms of symmetry, we're looking for normal symmetry. No? We are looking for asymmetrical, and well, if you're talking about an abnormal head symmetry, it's maybe turned to the left or turned to the right, or it's quite tilted, or maybe depressed. So you have to check if it is symmetrical to the opposite side. That's how you check for symmetry. And then in terms of position, a normal finding or inspection results in an upright position. But an abnormal position, as I've mentioned, is that maybe it is what? Totally tilted on one side, either front or back, left or right. It happens. It's observable. So you as the um, nurse or student nurse will be the one who's going to make that assessment and document. Now, in terms of palpating the skull, in checking for texture, then it should be hard and smooth. But what is not normal is having lumps and some tenderness. In terms of the temporomandibular joint, what is normal is about 3 to 6 centimeter vertical range with open mouth. Snapping or popping is common. Okay, so you have to check it. You open the mouth. You ask the client to open their mouth, and then what? You will be able to what? Palpate it, no? That there is a vertical range, yeah, while opening one's mouth. Yun yung normal. But pag wala siya, you will find pain, swelling, crepitus, restricted motion, deviation from one side of the opening of that mouth. So in short, there is uh, lack of comfort on the part of the patient when performing this simple test of opening the mouth. Okay, so yan siya. In terms of testing naman the motor function, cranial nerve 7, because it's located, this affects your facial muscles. You ask the patient to what? Smile, frown, raise your eyebrows, show your upper and lower teeth, diba? And then what? How do you do that? And then keeping your eyes tightly closed while what? You try to make open them, but do not press the eyeball section. You can just try to what? Pull it a bit higher or lower, but do not depress the balls. So what is normal? Again, it is what? Symmetrical. That is what we have right here is we have also there in terms of strength and movement of the facial muscles. What is not normal is that it loses its asymmetry. O kaya yung isa meron, yung isa wala. Okay? Okay, so one has movement, the other has none, or vice versa. They don't function normally in terms of strength and in terms of their facial muscle. Now, then if there is weakness, we will test it by what? Trying to make a small push in terms of what? In terms of the nasolabial fold, or in terms of drooping of the side of the face, or drooping of the lower lid. So, makikita niyo yun. You will see that you need to push it up. Okay? Or will they be able to hold it if they can hold it that way? So, we'll just watch a video on how to make the inspection and palpation. Now, this is an example of what a person who has Bell's palsy. So in a person with Bell's palsy, there is what? Smoothening of of their forehead, inability to close the eyelid. Ito, nagdodroop siya, nahihirapan talaga. Para kang merong, as if you have a what? A very thick eyelashes. So you can't open your eyes. And then in terms of drooping of the mouth corner, it's basically falling apart. But the face is falling. And even if the patient tries to put it up, try to practice the muscle on the face, there is difficulty because you have a problem in your cranial nerves. Okay. In terms of inspection and palpation of the cranial nerve 5, what is normal is that there is symmetrical jaw movement and equal muscle strength of the jaw, sufficient enough to prevent the examiner from separating the jaw. So that is what you're looking for. That is normal for a person. There is jaw sufficient strength enough to prevent you as the examiner to separate the jaw. In terms of abnormalities, what you are expecting that is not normal in your assessment is that there is what? Asymmetrical movement and inability or decreased ability to what? To separate the jaw. So there is this difficulty on the part of the patient or the client, to separate to close the jaw. In terms of sensory function, this time in cranial nerve 5, the sensation of light touch is expected. There is eyelids that blink, and then the cornea, when the cornea is touched with cotton. Now, in terms of abnormal findings, we have this absent or decreased or unequal sensation. So maybe there is little to absent capability of your patient to blink. These are expected for people who have problems in cranial nerve 5. In terms of size and symmetry of the facial features, what is normal is variable and symmetrical. What is not normal is that there is excessive or large or asymmetrical, distorted. There are presence of lesions and masses. In terms of size and symmetry of facial features. In terms of expressions, what you are expecting is there is variable, symmetric, centered head position. What is not normal in case of Bell's palsy, parotitis, and mask face, these facial expressions are asymmetrical and distorted features. We have hirsutism, and then tightened or sunken or swollen facial expressions. So please take note of these diseases, and you might want to look at it further. So So we have our salivary glands. You might want to test this also. So looking for the parotid gland, sublingual gland, and the mandibular gland. Now you can open it. Looks like they are what? Inflamed. So they're quite big. So don't be very observant because you might be mistaken with like just the shape of the face or chubbiness, something like that. So in terms of nose inspection, we inspect the nose for the position, if there are deformities, septal deviation, discharges, and of course flaring. What is normal for a person is that there is what? A midline and it is symmetrical, no deviation and no flaring. Okay, now if there is an alignment from previous trauma, from masses and congenital deformities, this is not normal and you have to put it down in your assessment. And then if there are nasal flaring, the nurse observes that an infant is experiencing nasal flaring. So what does this suggest? Kindly answer this one on your own. No? And then so you have an idea what nasal flaring is. Para siyang mainit. It feels hot. You feel red, looks red. So what does this suggest in terms of young people and also for adults? What does this suggest? Now, it's a question that you have to analyze also. Now, I'm asking for a deviated nasal septum. Now, what causes this one? It was mentioned a while ago that traumas and even birth defects can cause the nasal septum to be deviated. What does that mean to you? Well, physically, it's not good for you. And in the long run, it can cause also infection. But if you've outgrown it, you need to consult an ENT further. If you want, or maybe ako, ano, but for a lot of um, fans of cosmetic surgery, yan, sometimes they adjust the nose here at the middle and dito sa side pala, sorry, to retain the middle and then to push this up. So you can try your best to search surgical cosmetic surgery yan, videos to support this how do they do it. Okay, so in terms of your nose, don't be conscious kasi we have different and beautiful noses. So there are also um inspection that this requires check your color, not the color of fair skin, white skin, but it's more of changes, especially in cancer of the nose. It deviates in color. There are lots of lesions and maybe discharges. So this is what you are expected to see or expected to inspect. Okay, what is normal is that the mucosa is pink. It's not red. It's not blackish. It's not dry. Okay, and that there are no thick discharges or even edema. What are abnormal is that it's it has discharges that has to be drained. These are what we call mga clear discharges. There might be glucose spinal fluid if it tries to get out from your nose. These are common to children. Okay, and then bilateral drainage, no, there might be an allergic rhinitis. If it's yellow or green, there might be what, an upper respiratory tract infection. And then in terms of bloody trauma, a bloody discharge, it might come from your traumas, and any kind of trauma. Might be physical trauma, like for example, you bump your nose, and then hypertension. Sometimes hypertension causes what? Bleeding. So you might want to look into that. Okay. Olfaction is also tested by asking the patient to identify common odors such as what? The most common, and you cannot go mistaken, is coffee or mint. So you have to check if they are able to what? To smell. Okay, next. In terms of inspection of the lips, you check for the color, the condition, and lesion. So what is normal? It is pink, moist, intact, and has no lesion. But what we are looking for that is deviated is the it might be asymmetrical lips. This one is lower than this one, or this one is bigger than this one. Okay? Quite obviously, it's not symmetrical. Next, congenital deformities. There might be what? Cleft palates. And then trauma, maybe a bite, or maybe a cut. And then is there pallor, redness, cyanosis? Okay, in terms of color, in terms of lesions, and cheilitis or dehydration, is it dry? Now, assessing for breath or odor, or ability to what? To do pursed lips breathing. Can they do that or not? What is normal is that there is no odor and there is no pursed lip breathing. Okay, if you see a person who is pursed lip, there might be what? A problem with your breathing or lungs. You might want to what? Check on that. Also, in terms of assessment, you ask the patient to do what? Tongue exercises, lip exercises. You can ask the patient to what? Put your tongue out, diba? In, ability to what? To move the lips also, no? But it's more on the facial muscles. Okay? We're just talking about the senses here in terms of lip inspection. Halitosis is an infection from the GI. Usually those clients or patients who love to eat what do you call this? Intestines of animals or other um, uh, not common parts of animals, they get halitosis because you might not know what you can get from this animal as meat products. And so these are this cannot be treated by mere brushing your teeth. It has to be treated with the proper antibiotic. Another example here is that you will see that there are lesions near the lips. Ayan, if you will see here, there are lesions, breakouts. These are also being assessed. And then in terms of the lips also, you might want to consider this kind of abnormality or genetic abnormality where the nose is connected to the lips. Okay, they cannot do what? They cannot, this one requires what they call this surgical intervention. Okay, and correction. And this has long-term effects that you will have to study later on in your higher years. Okay, in terms of inspection or mucosa of the following, we have to check for color, condition, and lesion. Sorry. Okay, what is normal is it's pinkish, moist, intact, and has no lesion. In terms of abrasion, it is quite painful. There is inflammation and ulceration, such as in the case of an allergic stomatitis. And then white patches or oral thrush, especially for those who doesn't brush their teeth. Okay, and of course, if there are certain illnesses na, that causes the white patches, there are certain habits or behavior. And then commonly they treat it with salt and water as home remedy. But sometimes it's too big and it requires medical intervention or medicine already. So you have to see this also. So you ask the patient to open their mouths. Yeah. And this is very common. Yeah. These are allergic stomatitis. In terms of your gums, you have, but again, to check for the color condition, bleeding, lesions, and presence of dentures. Now, is it pink, moist, intact? Of course, you're expecting that there is no blood or hypertrophy. Now, what is not normal is that your gums are inflamed in the case of what? Such as in the case of leukemia. Now, this gingival hyperplasia, it is as if we don't notice it, but actually some what do you call this? A lot of people are very very concerned about uh, the feeling of fullness in your gums, either the upper or the lower ones. And then for those with chronic gingivitis, it's either you have a pale gums, it's supposed to be pinkish, diba? But it's quite pale, and you will see it's somewhat lesser of a pink color. Yeah, this one is reddish. This is what we call the hyperplasia. It's bigger. The gums are already bigger. The teeth is so small. But the color, of course, this is the right color. Yeah, just enough. This one, if it's too red, then that's also an inflamed looking gums. So please supplement our discussion with your own researches and photos, so that you might want to look at this common oral, what do you call this, oral inspection results. Okay, whether it's normal, whether it's abnormal, please supplement so that you will know more. Well, teeth inspection, of course, the number, the color condition, but you ask permission always, ha. You don't just open the mouth of a patient. You ask them to do it for you. It means there is consent on their part. Ma'am, why do we have to inform the patient about this one? We have to get the inspection already. We have a lot of patients, and we have to what do you call this? We have to finish once and for all our health assessment. The sad part is it's not easy for someone to just open the mouth. This is as sacred as your, genitals also. You just don't open your mouth to anyone. And even in our food ethics or our personal ethics, we just don't, even if we laugh, diba? Even if we laugh, we cover our mouth. No, we don't just show our mouth. There are cultural uh, uh, impressions on this one. So please ask for consent before you make the um, assessment, if it's okay with them, especially if they have bad mouth, they are not comfortable doing so. So a normal tooth is like 32 teeth in adult, 20 in children estimate, and then white, light yellow, no caries, no missing or loose tooth. You don't need to count them. Okay. You can just observe if you find it to be annoying to ask the patient about I don't need how many teeth do you have? You don't do that. Okay. So you may want to ask more discreetly, use other words such as what? Um, is it okay that we talk about what? Your teeth? You may want to open that one, okay? Or you can just observe it when the person talks, okay? And then loose, what is abnormal is that there is loose malalignment of teeth, dental caries, teeth gray, tetracycline, because before we are not using the white, the the what do you call this, the silvers. We're using this way back before. We're using silver in covering for caries, but now we're using the white ones, so which is less toxic. Okay, so there are also those who has gray teeth, um and then for tetracycline, these are the ones whom the mother has taken way back before this medicine when they have children, when they are pregnant with their children. The children were the ones who got the gray teeth, okay, and some weaker teeth. So you might want to consider that first, not because that they have diseases, but maybe their parents or their mother used tetracycline way back before. I'm not pretty sure if OBs are already using that one. Okay, so please don't be surprised also in terms of checking for these conditions. Question: a loose tooth pose a threat of what? Infection. Okay, and what? Not bleeding. Ano pa? Gum problems. In terms of tongue inspection, so we're inspecting teeth for the following. We have color, texture, position, and mobility to check for. Yan yung sinasabi kanina that we have to what? Check for the what? Mobility of the tongue, the ability of the patient or the client to move their tongue. So what? How do we do it? Diba? Left, right, up, down. Okay? In terms of an abnormal finding, we're looking for ulcerations, black hair tongue. This is an example of a what? A fungal infection. And then painful, reddened, and chemical irritants can also cause what? Burning of your tongue. This is an oral thrush. It's a fungal infection. So, as I've mentioned, please ask for consent and do not, for example, this one, the inspector or the examiner is using a what? A a cloth or a tissue, not directly touching the tongue. My God, please don't do that. Okay. Next, hard or soft palates, tonsils, and the uvula inspection. So you have to check again for the color condition, the lesions and the drainage of what, and if there are exudates also. So in terms of normal findings, it has to be pink, symmetrical, and there is this symmetrical rise in the uvula. So where is the uvula? It's the one that hangs at the middle of your throat. Okay. If it is hard, if the cleft palates are what? Um, hard or soft. Okay, there is tenderness or there is hardness, then that is not normal. Your tonsils are hardened. Okay, you can feel it here. And then there are enlargement of your what, tonsils, and some with exudates. You can use your pen light to view if the what, If the throat or the trachea is what, or the tonsils are basically the tonsils are closing already the airway. If it is too big, yeah, you have to take note of this one. And then the uvula, again, it has a symmetrical rise. So this is your uvula. This is the one that hangs at the middle of your throat. Okay. And a review, this is your soft palate. These are soft. It's not supposed to be what? Rough. It's not supposed to be what? So tender. Now, this is your tonsils. Some with those with exudates, they are like closing your airway here, and that is so dangerous. And then our tongue is located here. So please make your inspection from the what, top, and then the sublingual, and also and here in this area if there are what, lesions. Okay, so here are the pictures. You might want to test it out also. And then in terms of swallowing, we have to test the patient's swallowing. Yeah. So what is normal is that there is ability to what? Swallow and do the gag reflex. What is not normal is they cannot swallow, no, nor make the gag reflex. So what is a gag reflex in stroke? What absence of gag reflex in stroke patient poses a risk for what? Okay, what does why is it risky? Well, if you cannot what, throw out, then if there is what, a problem or there is an obstruction in your trachea, you cannot throw it out. So it will just block or obstruct your airway. So be very careful when feeding stroke patients. They are risk for what? Choking. In terms of neck inspection, you continue what? Checking for what? For the appearance. You have to have it symmetrical, and then there are no swelling. So it has to be what? Smooth and what? Symmetrical to the head. Now, in terms of movement, what is normal is that there is voluntary controlled movements. You can do what? Range of motion or range of motion. You are able to do it at your own will, where all of your what? Neck has the ability to move from whatever what part, except as I've mentioned a while ago, your head only what rotates from left to right. If a patient is already controlling his head from 360 degrees, you might want to change one who's making the examination. Okay, you might need a priest. Next, in terms of abnormality, what we are looking for is that there is rigidity. There might be what? A tetanus. And then jerky movements. So it's jerky. There are movements. Limited RON. There is pain if you tilt it to the left, such as in the case of what? Stiff neck. I'm sure you've felt that before. And pain on movement or stiffness or rigidity, such as in the case of what? Arthritis and meningitis. In terms of the trachea, thyroid, and lymph node, you first palpate the trachea, then the thyroid, and then the cervical lymph nodes. That is the order in terms of palpation. What is normal is that you find it at the middle position, symmetrical, and there are landmarks identifiable. Now, what is not normal is that there is asymmetrical. It is asymmetrical. It's not symmetrical basically. So it deviates from the midline. There are tumors, goiters, and pneumothorax. such in these cases. So you know what a tumor looks like? It's hard. No, there might be what a bump here, and there are goiters. Likewise, it might be tender and has a bump here, and then pneumothorax also. In terms of symmetrical line, it's also deviated in some, but it's not observable all the time. So you have to check for what other body parts later on. Okay. So in the patient with severe pneumothorax, what abnormality in the trachea will you observe? Yeah. So you might want to answer this, and then we'll get back to you when we see each other. Now, in terms of palpating the thyroid, is what you have to do is to stand behind the client and position your hands with thumbs on the client's nape. Okay, we'll show a short video of this. Then ask the client to put the head back slightly and the index finger just below the thyroid cartilage. Mom, why is it not fronting? You might not know if your patient has another disease. You can make that assessment at the back, positioning. Okay? As position. Now, ask client to swallow water and feel for the rise of the thyroid and palpate also the lateral lobe. So you can go to the front and then what? Ask the patient to swallow water. So you can observe if there is difficulty in swallowing, if there are lumps that are not visible on your observation or inspection phase. Next, okay, that's one way to do it to supplement your observations. Now, for palpation, we also have to do what? A midline and deviated mass assessment. No? In terms of characteristics or landmarks, it has to be smooth, firm, and enlarged and tendered thyroid. So you have to practice this one. So ito yung sinasabi na you can you can position yourself at the back of the patient. You don't need to front the patient, especially that's face to face. In terms of lymph node palpation, there must be it is not normal if there must be an enlarged and tender nodes. If there are irregular borders and greater than 1 cm. Now, in case of metastatic CA, there are hard and fixed. These are commonly the what do you call this? The basic these are common in thyroid CA or lymph node CA. So it's hard and fixed. Now, for HIV infection, you can observe that there is an enlarged occipital node. What is normal is that it has to be less than 1 cm and round. Okay? So anything that is not palpable lymph node around the 1 cm, and if it's bigger, that is something you have to you ask the patient to check with the physician further. This is very important, especially if the patient has history of CE. Okay. So for now, that would be our assessment. Please supplement with videos on how you will be doing it. I will give you also our supplemental video link. Thank you very much.